Hello, everyone. Welcome to MiceTech Talk with the Technical Information Scientist at the Jackson Laboratory. My name is Dr. Xin Tong, and my job as a Technical Information Scientist is to serve the research community by answering all the mouse-related research questions or technical questions.
Hi, my name is Dr. Dolores, and I'm coming to you from Sacramento, California.
Yep.
MiceTech is a way for us to connect with the research community and answer some of those mouse-related questions live.
So hopefully you have already with your questions and coffee or tea, because it is time for MiceTech Talk. So today, let's talk the basics of designing experiments with mouse models.
Great. So there are many important aspects to consider when designing in vivo experiments, from the importance of the mouse models that you choose and controls, how you house the mice, the choice of readouts that you pick, and other pillars to achieve robust, reliable, and reproducible results. For example, if you are planning to evaluate the potential of novel therapeutic agents to treat disease. And today, we will summarize the basics you will need to keep in mind as you design experiments with mouse models.
Yep, so we have prepared a few discussion topics. For those of you watching live, please use the comment sections of the video from either LinkedIn or YouTube to tell us where you are viewing from and any experimental design related questions you may have. We'll try our best to answer all of your questions today. And if we cannot cover all of it, please send it to our email, micetech@jax.org. So let's begin. So Dolores, what do you think would be the most important factors to consider when designing a study?
That's a great question. So I would start by asking, what readouts are you trying to measure in your experiments? This can guide you in selecting a mouse model that has a robust phenotype you need to evaluate. For example, be aware that many times a model comes in different genetic backgrounds, so you may want to pick the background that will work best for you.
Yeah, a very good example to mention here is the IL-2 knockout mouse strains. So we have the interleukin-2 knockout strains on very different genetic background. And the development of the progressive colitis is actually health dependent if the IL-2 knockout strain is on the C57 black 6 genetic background. So if the model is maintained on the pathogen-free room, it will not develop colitis for a long time. Also, be aware that which genotype can produce your desired phenotype. For example, the majority of our Cre expression or Cre reporter strains, the heterozygous or hemizygous, if it's a transgene for the Cre strain or reporter strain, would be sufficient for Cre expression and reporter expression in the desired tissues. On the other hand, please also note for many homozygous transgenic Cre mice that have a phenotype of their own, and they may not be viable or fertile. So some other critical questions you need to ask yourselves would be, given your hypothesis, does the mouse model make sense? For example, if you are modeling a human disease, how does the mechanism of a disease development compared with the mouse and human? Does the desired phenotype vary with the sex, age, or genetic background, as we just mentioned, the great example?
Right. Another thing to consider is how might the animals' housing conditions, their health status, and the microbiome, as you explained in your example, Xingtong, how would all those other things affect the phenotype? You also need to keep in mind what are the limitations to using a particular strain. And it often happens that researchers need multiple models to answer completely different research questions.
Yeah, all in all, you should have a thorough understanding of your study. You should have a thorough understanding of the mouse models that you choose to use. So I know there are several basic principles of experimental design. Dolores, would you please comment on those principles?
Absolutely. So the pillars to achieving robust, reliable results to evaluate the potential of new therapeutics and to treat disease were recently reviewed by Stacy, Sakov, Rizzo, and Silverman in 2016. I really liked their paper. The paper is more focused on behavioral studies and pharmaceutical compounds used for neuro diseases, but the principles apply across the research areas. So one of the pillars of this would be a good choice of controls. Not only the control mouse model, but when you're screening compounds, make sure that the vehicle control is included within the experimental design. The vehicle control group should receive the same vehicle that the test compound is formulated and is matched for experiments and for excipients, and pH levels. It's very important that the vehicle is delivered in the same route as the test article to make sure that when you are experimenting with the mice, your test subjects are exposed to the same handling conditions, because that can change things quite a bit. So Shinton had a previous MiceTech talk, episode 7, where he and Janine discussed the choice of control strains. So we're not gonna talk about this today, but if you're interested in that, I suggest that you go and look at that episode. Another of the pillars important for experimental design is randomization. What this means is that the test subjects, in this case mice, should be randomly assigned to treatment groups. Another key aspect is to keep in mind what is known as counterbalancing. This is when baseline testing is conducted such that the drug treatment is compared to pre-treatment baselines. Make sure that you are counterbalancing evenly across treatment groups. For example, you can think about body weights. You don't want all the chubby mice to be in one group and all the skinny mice to be in another one. You want to counterbalance them. So each treatment group should be evenly represented by low and high weight in this example, so that there are not any statistical differences across groups prior to testing your drug. Another one that is key that not everybody does is blinding. At the very least, the technician evaluating the phenotype and analyzing the data should not be aware of which is a treatment group and which one is a control group. This is critical to prevent unintended impact of bias into your data. Another key one that a lot of people downplay is proficiency. Many methods employed for phenotyping and pharmacological experiments are complex, and they should be conducted only by very well-trained technicians that have demonstrated proficiency doing that precise method. It is very important to be aware of the limitations of the testing environment, where your equipment is located, and then optimizing the environment so that you make sure that it is sensitive to detect the expected outcomes.
Yeah, I agree with you. The technical proficiency is very important. And even though sometimes acquiring technical proficiency can take time and add to the project budget, but this is definitely necessary, because the ultimate goal of preclinical studies is to identify the disease prevalent and translational endpoints to be robust, reliable, and then reproducible, and so that we can use what we found to evaluate the potential therapeutic agents, and even so to cure a disease.
That's great. I'm looking at the comments here from our listeners, and there's people from Brazil, from Philadelphia, from Washington, from Argentina, Spain, Nigeria. So hello to everybody listening.
Hello.
So the last pillar that is key for robust experimental design is sample size. We get a lot of questions about this, and really the proper sample size should be calculated by the power analysis method using the effect size, standard deviation, and other considerations. So what happens is that if the cohort that you're using is too small, you may miss the real effect in the experiment. And if the cohort, on the other hand, is too big, then this will lead to unnecessary resources, unnecessary animals to find out a similar conclusion. That is why we recommend you to do pilot studies whenever you're working with a new model or a new assay. So, Shinton, can you tell us a little bit more about this?
Yes, so definitely when you are designing an experiment using a new mouse model, we always recommend to perform a pilot study for the reasons because first of all, you want to check if this model can produce a robust phenotype to answer the scientific questions. And furthermore, you want to use these pilot studies to help you decide how many animals you should be included in each group to make sure you can observe a significant difference, while you are not using too many unnecessary mice to observe the same result. Actually, even for the mouse models, that has been well published in the literature, you should also perform a pilot study at least before using the large cohorts of animals, so that you can make sure the phenotype replicates in your facility. Like, a lot of things could be different, like the equipment, microbiome, the housing conditions. Both of these may affecting the phenotype. So, looks like I have seen a few very good questions is coming up. Dolores, are you ready to answer to take one of that? Let me read that to you. So there are two
Sure.
questions actually similar, which is about regarding randomization. What would be a good way to do this for tumor models? And the same questions is from another researcher is asking about what's the best randomization method to adopt in a cancer study. I feel like these two can be combined together.
Right, right. And I'll give you my comment, and you can complement me, Xington.
Yeah.
I know you have a lot of experience with cancer research. So, for example, with patient-derived xenografts, one of the questions is about that. So basically, what happens when you do those types of experiments? You're engrafted little tiny chunks of tumor in the mice that will have different growth rates. Typically, they don't. It's not like a cell line where they are all growing at the same rate. So one of the things that you can think about that is you don't want to put all of your groups with the bigger tumors in the treatment group or in the control group and all of the small ones in another. You want to randomize by tumor growth. So that would be something to keep in mind. Same thing with body weight. Do you have any comments on how you would randomize?
Yeah, so for the cancer studies, the same. I agree with you that when you are doing the PDX models, like you may have a different cages. You should not using only one cage for the control and one cage for the treatment. You may want to randomly assign the treatment groups and control groups through these multiple cages. And another thing we did is actually the blending. Is that you may not want to know which mice are treated with control, which mice are treated with the treatment agent, the therapeutic agent, so that you just do not want to introduce any bias into the experimental design of studies. Yeah, so let's see, there's another question. So as we talk about the sample size, what would be the reasonable sample size for a study?
Okay, yeah, we get that question all the time, and it really depends on on what is the phenotype that you are looking at and how robust is that phenotype. So from Stacy Reeser's experience, she used to work at the Jackson Laboratory. She has a ton of experience doing efficacy studies, and she has optimized and validated so many different phenotypic measurements. And in her experience, previous power analysis, taught her that group sizes anywhere from 7 to 20 mice per sex, per genotype, per treatment are typically the minimal sample size required to achieve statistical significance for a given assay. But again, the spread from 7 to 20 is quite big. So it depends on how strong of a phenotype you're seeing, and that's the kind of information that you will find out if you do a pilot study.
Yes,
and my advice is that after you do the pilot study, show it to a statistician, a biostatistician, for additional comments.
Great. So I see another question coming from our audience. So I think it's two questions, and we can combine them together too. So the question is it possible to blind your treatment groups if you are working on a project on your own, or do you have to have a collaborator to help? The same question is about how you can overcome the limitations, maybe you have shortage of people in the lab while you are trying to apply the basic principles of designing the experiment design.
So one of the things to do that, and that happens in small labs, like you're saying, and let's say you are in charge, you're in charge of everything. You're in charge of raising the mice, treating them and following them up and running the assays. So what you can do is, like, if you have your compounds, you have your vehicle and you have your treatment compound, what you can do is have a colleague perhaps from a different lab to blind you on which tube is what, for example. That is one thing that is fairly easy to do. The other thing that you can do is ask a friend or a colleague to blind the cage cards, so you don't know, so you're the only one doing everything, but at least you don't know which page is which. So that would be, one suggestion, but not because you're the only one doing everything is an excuse not to blind yourself. And trust me, you're going to be so much more confident when you get good results when you're blinded, as opposed to when you knew kind of what you were doing. There's a little bit of bias that can seep in, and we have to do our best to avoid that.
Yes, I totally agree with you. So, well, look at the time. I think that's all we have for questions this week. And we also have linked a few resources in the video description. Dr. Dolores, can you quickly comment on those too?
Yes. So we have written at the Jackson Laboratory Technical Information Team, we have written 2 blog posts. One is Experimental Design, Top 4 Strategies for Reproducible Mouse Research. And another one is How to Design Robust Preclinical Efficacy Studies that Make a Difference. So I would encourage you to take a look at those for additional information and additional tips on top of what we discussed today.
Okay. So our next MiceTech talk is called Let's Talk Genotyping, next Tuesday, September 1st, 2020. We look forward to seeing you on LinkedIn and YouTube. This is Dr. Xintong saying stay healthy, stay safe, and stay excited about your research.
Bye, everybody.
Bye-bye.